Some classic things that people come to the ear, nose, and throat doctor for, like dizziness. That's one of those things. Just imagine any time you've been dizzy and how would you describe that to someone of what you experienced? And there are some times where it's really easy of, oh, I stood up quickly and I got lightheaded. Well, that's not even necessarily ear, nose, and throat problem, but it's still something where that's an easy to describe. But there are some other experiences of dizziness where it's just, I don't even know how to describe it. I just feel this. Or another common one where it's really hard to figure out is postnasal drainage. Believe it or not, a lot of people would think, oh, postnasal drainage, it's got to be coming from my nose. I have a nose problem. There are things like heartburn and reflux that cause that symptom of postnasal drainage where people are like, I don't have heartburn. That's not something I deal with. Well, actually, your manifestation of your reflux is that drainage that you're experiencing, that throat clearing that you're getting, that kind of like, oh, I have something stuck in my throat. That's actually from that. And so a lot of people, we're all connected. And I think everybody knows that on a certain level, but they just maybe don't think that it's coming from something else that is connected. And so I think that, of course, ties in a lot. And that's where the diagnosis gets really fuzzy. And sometimes there's trial and error of, well, if we want to get a definitive diagnosis, it requires these tests that may or may not be invasive. And so why don't we just try some medication first? And I know that can be frustrating for some patients, but some patients really appreciate it. Like we were talking about before with the social concerns, I don't have time to go get that kind of test done. But I do have time to take a pill for a couple times a day for a week and see how it goes. Or they can modify their lifestyle, XYZ. So sometimes there is a component of trial and error for your diagnosis.
Okay.